Welcome to the Hen House Podcast, where mothers rise together in authentic conversation and sacred connection. With your hosts, Chantal Breanne and Andrea Sjoeberg. It's time to jump into the Hen House. Okay, so welcome back to the Hen House Podcast. And this week, I kind of want to go into sharing some of my experiences. I was sick last week, and Andrea shared about Webster chiropractor and some of her experiences with her birth. And I wanted to share about my birth of my daughter, because that experience led me to this line of work. It had a significant impact on me. And I believe it's all tied into advocacy for moms and babies, perinatal mental health, and birth trauma, and PMADs, perinatal mental health disorders. So the reason why I think this is such a big issue is because I believe that the time after your baby is born is such a fragile time for the mom's mental health. It's such a vulnerable time, and there's so many factors that go into why it's such a vulnerable time. But the way a woman is treated during that time is extremely important and significant. So shout out to all the amazing nurses and doctors out there. And then on the other hand of that, there are some not so great ones. So basically, I've shared my birth story before. I was on 2 podcasts where I shared my birth stories. So I don't really necessarily want to go into my birth story specifically. What I want to talk about is my postpartum experience. I had planned a home birth and ultimately ended up at the hospital due to some complication, retained placenta, and postpartum preeclampsia, which I did not find out right away. So there's actually a huge stigma for me personally. I am and have been experienced a lot of shame over the way I handled my postpartum experience, because ultimately what it ended up doing was, in terms of leaving the hospital AMA, I ended up putting my own life in danger. But this is why I say it's like the postpartum period is so fragile. So basically, working as a doula, I've seen this happen many times. And now seeing it from the outsider view, I'm like, yes, I love the hospital AMA, but I truly believe had the medical staff behaved differently, it would have never gotten to that point. So basically, my daughter was born with, and she developed jaundice, which is a super common condition in babies, especially breastfed babies, and where their bilirubin levels become extremely high, and they have a blue light that they use to treat the jaundice. And they can also, baby nursing can help to move the bilirubin through their system. And I had been nursing my daughter, but my milk was taking some time to come in because of the fact that I needed several blood transfusions and, all that I went through with the birth. So my milk was a little bit delayed. And also because they had my daughter on the blue light and they had given her a pacifier, she was having some issues latching. And that was, of course, causing me distress because I really was passionate about breastfeeding. And, it had been a difficult night. I think this was maybe my second night in the hospital. And my daughter, the nurses kept swaddling her, giving her the pacifier and putting her under the blue light for the bilirubin. And I had kind of decided that, she would be crying there because she wanted to be held. So I got her and was holding her and nursing her. And I had kind of found a way to move the blue light over. So it was like I could still hold her, but she would still be under the blue light. I believe I was being bullied by the nurses. I was being talked down to, treated extremely disrespectfully, no help with breastfeeding, no attempt to help me, just giving me blank stares when I'm having a screaming baby trying to latch. And then they would just give her the pacifier and say, well, maybe you should try formula. And I was like, I don't want to do formula. I want to breastfeed and my milk is going to come in. And yeah, so there was no assistance. So I had a rough night trying to get her to latch, finally got her to latch, and like things are starting to feel calm and good. But the nurse comes in and I'm holding her and she just like it's the middle of the night, probably like 4 a.m. She just loses it on me. Like, what are you doing? Like, why is baby not under the blue light? She has jaundice and she needs to be under that blue light at all times, and just like 0 to 100, right? Tries to grab my baby from me and put her on the blue light. And I'm like, no, like, I was like, I'm breastfeeding. She needs to eat. One of the ways to remove the bilirubin is to nurse and feed her. She's lying there cold, swaddled under a blue light. She wants to be held. And I was so angry about it that I think that the night previously, because I was already having an issue with this blue light, I had called my pediatrician because I wanted to leave the hospital. And I was like, do y'all have a blue light? Like my newborn has jaundice. I want to go home. They're not letting me leave the hospital. And they're not letting me hold my baby. Like, I just want to get a blue light. And my pediatrician was like, yes, we absolutely have a blue light. It's portable. So you can actually hold baby with the blue light on her back. And you could like slip it. It was like a small little portable billy light. And I could slip it under her shirt. Like, there was lots of ways that she could get that blue light to help with the jaundice. So, when the nurse came in and freaked out on me, I was just like only really thinking about my daughter. And I was like, you won't even let me hold my newborn. Like, I'm leaving. So I freaked out. I was like, pack the bags. Like, I'm out of here. Not even considering the fact that I was experiencing postpartum preeclampsia, which actually nobody explained to me. They just told me I had high blood pressure. And I was like, oh, right, because I'm stressed because y'all are yelling at me every 5 minutes and coming into my hospital room and stressing me out. So I'm like, if I can just go home, I'll be fine. So I freaked out and I told the nurse I'm leaving. And I think she actually started to feel kind of bad at that point. Now, this hospital is closed. It was Atlanta Medical Center. Don't recommend. And I left. And then, of course, I got home. I first thing in the morning drove to the pediatrician, got the blue light, drove to CHOA, got the heel prick, drove to CHOA again, got the heel prick again. And it's like my daughter's bilirubin levels are going down. And I'm like, awesome. Of course, when I left, they gave me the whole like, oh, your insurance probably won't cover this. And, if you leave AMA and, child services might have to get involved and all that, which I think is bullying. I think it's coercion. Like, I don't agree with that. Okay. And that is one of my big issues is when they say things like that when you're already in such a vulnerable state. However, granted, I should not have left the hospital because I had postpartum preeclampsia and I did not know that because nobody told me that. So I ended up back in the ER at another hospital, diagnosed with postpartum preeclampsia. They let my newborn stay with me. Her jaundice had cleared up at that point. She was under the care of her pediatrician. And this hospital was a breastfeeding friendly hospital. So while I was on the the magnesium drip to treat preeclampsia, they said as long as I had someone in there, like I could have my baby roomed in with me and I could hold her. And Emory Midtown, like hands down, amazing hospital, amazing doctors. The main difference was that I felt like they were a part of my care, that they were listening to me and they treated me with respect. Where at Atlanta Medical Center, they treated me with absolutely no respect, no informed consent. They would just do things. And when you perform medical procedures or do things or treat patients in a certain way, they're going to lose respect for you. and they're going to lose trust in you, and then they're going to make stupid decisions. Like, gone are the days where people just blindly trust their providers for good reason. The third leading cause of death is medical error. So it's a big deal. So there's a serious line to be towed. And I believe that in my situation, had the nurses had a little bit more respect, a little bit of bedside manner, treated me with respect because I was so vulnerable. I had been through so much. My mind was racing. I was worried about my daughter. And all I really needed at that time was someone to explain to me what was going on, to act like they cared, and to advocate and support me. Instead, I was just met with rude, judgmental, unhelpful care. So, yeah, I believe that the nurses at Atlanta Medical Center failed me. And I'm not surprised that hospitals closed down. And I bring this up because I've seen this happen. I had a patient recently, not a patient, a client, a mom, who I was her doula, who experienced postpartum, who experienced preeclampsia as well. And nobody took the time to explain to her what was happening. And they were giving her medications, and she genuinely thought she was dying because nobody took the time to explain it to her, what her condition was, what the outcome was, the fact that she was going to be okay. And another client that I had recently, another mom, her baby, she arrived to the hospital in labor, and they didn't believe that she was in active labor. And now she was GBS positive, which GBS is it's a naturally occurring bacteria in the vaginal tract that can sometimes cause complications to baby if babies contract it during delivery. So they usually prescribe IV antibiotics during childbirth when you're GBS positive. They did not believe that she was in labor, I guess because she was just handling her contractions so well and she had done hypnobirthing. Now, they did not give her the medication for GBS, and her labor actually went extremely fast. And baby was born within, like, I think 4 hours of her being there. And they had not given her the IV pain or the IV antibiotics. And so next day, mom's healthy, baby's latching, and mom wants to go home. And dad wants to go home, and mom and dad are cleared to go home. However, due to their medical error of not giving her GBS antibiotics, they said, well, baby can't leave because we're not sure if baby's okay because of their error. And they wouldn't let mom and dad leave, and they also wouldn't have a pediatrician come to talk with them. They were just kind of icing them out and leaving them confused and wondering when they were going to be able to leave. And I think they even said, like, we have a follow-up with our pediatrician, like we can make sure baby's fine tomorrow with a pediatrician. And they were seriously considering leaving. So what had happened was the woman's husband had left the room, and one of the nurses decided to come in and basically corner mom and baby and be like, if you leave right now, we're calling CPS, and they're going to launch an investigation into your negligence and blah, blah, blah. And basically bullied her into staying. This girl was in tears. She was traumatized. She was horrified. Like, they're going to call CPS on me. And not only that, they did it when she was alone, which is a tactic I've noticed with hospital staff, is they love to corner moms when they're alone and tell them horrifying things. And it's not okay. That's what happened to me when I got cornered with the Billy Light. And I've seen it happen time and time again, to where the point that I don't believe this is coincidence. I believe this is a bullying tactic that they use. So of course they didn't leave because they didn't want CPS to be called. They complied, but of course they did, right? And one could argue that, okay, they were thinking about baby's safety, and I understand that, but then why did you need to use bullying and coercion? Like, why not do it in a kind way when it was really their error for not giving the medication? And so this is why I believe advocacy is so, so, so important. And this is why I believe in doulas, because if nothing else, a doula is a third eye who is not actively being a patient who is watching what's happening. I can't tell you how many times I've actually witnessed medical errors or negligence as a doula. And of course, I'm not going to say anything if my clients don't say anything or not, you know, not upset about it or everything turns out fine, because usually it does. But of course, there's times when it doesn't. But I believe having a doula to advocate for you and to give you that sense of power, because there's a sense of hopelessness, there's a sense of feeling trapped when you're in the hospital postpartum. And it's not a good feeling. I experienced it myself. I've seen other moms go through it. And I believe that there are amazing postpartum nurses. There are amazing doctors, but then on the other hand, there are not so good ones. And that's what I think needs to change. There's no reason for it. You know, it's I believe that all postpartum nurses and doctors should have perinatal mental health training, and they should have better bedside manner, because it's just such a fragile time. You're starting, that's the start of people's journey into parenthood. And you want to be able to trust the system that is there to protect you. And in order to trust it, there needs to be mutual respect. So, it's a big issue. And it's not going to change overnight, but it's also not going to change by bullying, coercion, and lack of informed consent. It's not. Another thing that I'm super passionate about is choosing your provider and choosing your hospital when you're giving birth, because you want to have a provider who listens and respects you, who, and there was I believe, evidence-based birth. A lot of people believe that certain hospitals have higher C-section rates, which is absolutely true. But I think the main indicator, it's more provider specific rather than hospital specific. So you want to find a provider who has witnessed natural vaginal birth, who's comfortable with natural vaginal birth. I can't tell you as a doula how many times I've witnessed doctors absolutely terrified of natural vaginal birth. And you know what? I have empathy. I have respect for doctors, because I know that they see a lot. When a doctor is going into a vaginal birth and say baby's taking a long time in the pushing phase or X, Y, and Z, we don't know. So their last birth could have been a situation where, baby got stuck, or it was shoulder dystocia, or there was a vacuum delivery gone wrong. And doctors are carrying a lot of trauma into their deliveries. And this is why the whole medical system needs help. Medical errors should not be that high. I had one client where her doctor, they do 24-hour shifts. Me personally, I would not feel comfortable, someone who's going on 24 hours of work, being the one to deliver my baby. Like, pushing a baby out is such an intense experience. You need someone who is fully rested, has the grit, believes in you, and is able to support you through that. You don't want someone who's coming off a 24-hour shift, And so, like, we have to understand that doctors are humans too. I had witnessed a mom who was hemorrhaging post childbirth, and, her doctor was nowhere to be found. So they called in the on-call doctor for the hospital, who was actually not her doctor. Well, thankfully it was a seasoned nurse who recognized the hemorrhage, right? Actually, I saw the whole thing go down. And this is why it's scary. One nurse says, "Oh, she's bled this much." And then the other nurse says, "Well, how much is it?" And they're fighting back and forth. And then they check the notes and they're like, "Oh, it's actually this much." And then there's a little bit of panic. And then another more seasoned nurse comes in and says, "Hey, I just changed her and she's bled this much." And then the room gets stormed. Turns out she's hemorrhaging. The on-call doctor comes in, basically says a lot to try and identify the cause of the hemorrhage, tells the nurse, "I don't know what's happening, but I have another patient I have to go see," leaves. And I'm sitting there as the doula, like, she's hemorrhaging and the doctor just left. And the nurse is kind of like, "What the fuck? This is not okay." Probably a good 20 minutes later, her actual doctor comes in. and puts in a balloon, to stop the hemorrhage. And I'm not sure, how they identified what caused it, but watching as a third party, it's scary. It's like these are people's lives on the line. You want someone who's on it, and healthcare workers are overworked. So I'm not here saying that healthcare workers suck, and their job is incredibly hard. They need more support. There needs to be more healthcare workers. There needs to be better support for them, better training, doulas as well. Like it's serious work. And I have high respect for doctors and nurses who do this work every day. But just seeing it from a patient and from a doula's perspective, I've seen the effect it can have on mom's mental health when you have a good doctor nurse versus a bad doctor nurse. For example, after my son's birth, I had an amazing doctor or nurse when I was terrified because I didn't know what had just happened. I didn't know if I was going to be okay. And she held my hand, looked at me, and she was like, "You are going to be okay. Like, you're okay. You're safe." And that gave me so much peace. And I witnessed at another birth recently. It wasn't even a nurse. It was a healthcare tech give a mom an extreme pep talk, telling her how amazing she is, how amazing she's doing. And mom's blood pressure went from 150 over 100. It normalized from that pep talk. Like the way people treat you, the energy in the birthing room, the energy in the hospital, the provider's mentality has such an extreme effect on mental health, on anxiety, on stress, on blood pressure, on health, and it's all interconnected. That's why I think doulas are awesome, but it can't just stop there. Like doulas are limited in what they can do. Doctors and nurses, the ones that are amazing and I love you, but all I ask as a birth worker, as a mom of two, is that if you are in the birth space, if you are a postpartum nurse, labor and delivery nurse, a doctor, to treat your clients with respect, to practice informed consent, and to not use bullying and coercion tactics. Treat them with respect, like they are a part of their own care. Gone are the days where we can just treat people like patients, like they don't know anything. We require and deserve change. Women and mothers require and deserve change. The fact that there's a maternal mortality crisis in this country is happening for a reason. And I am very passionate about advocating and finding solutions to that. So, that's kind of just basically what I wanted to touch on in this week. It's a heavy topic, but something I'm super passionate about. If you have any questions or you want to share your own story, please comment, hit us up. If you have a story you'd want to share, we'd love to have you on the podcast. But until next week, bye, guys.